My name is Patty Garrity, and I'm the director of 11th Street Family Health Services. 11th Street Family Health Services is a comprehensive nurse-managed health center to provide services to help the community stay healthy, get healthier, and also treat their illnesses. I think it's important that 11th Street Health Center is located right in the middle of this very active community. It's because we try to take care of people in the context of their family and their community.
Squeeze, 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 squeeze hard.
We take a holistic approach to the care of our patients. So for instance, you come in to see the nurse practitioner, but you might often also see a therapist who's integrated into primary care.
How's your mood been?
My mood been good, yeah.
Okay, good.
We have a health educator, a nutritionist, social workers, cooking classes. We have a fitness center. We have physical therapy.
My name is Gail Partridge. Here at 11th Street, I am the primary care coordinator.
No, I mean, don't think of medication as strong, just think of it as, is it doing what it needs to do?
Yeah.
The benefit here specifically to this nurse managed health center is that it's almost like one-stop shopping.
140/90. That's a little bit better than what they had, but it's still too high. So I'm going to add
Our patients live in trauma and live in an area of trauma, and so for them this is a safe haven right in their community.
I'm Samantha Cruise. I'm 20 years old and I'm going into my 3rd year of nursing school at Drexel University.
So now you're going to invert your bottle and your syringe. Great. Now you have to pull down, right, so your needle's great, perfect. And now pull back.
I think working at 11th Street, you get the opportunity to really know your patients. The patients are the most important part here, and it's about the person as a whole, not just a broken bone or high blood pressure. They're seen as a whole person, and their health is not just their physical self, but their spiritual and mental self as well.
We see a lot of mostly women, though we're seeing more and more men, but women, middle-aged women with multiple chronic illnesses. They have hypertension, they have diabetes, they have obesity, and have never thought of themselves as the one to really take charge of their health.
My name is Joanne Bogan. I'm 61 years old. I'm being treated for 2 strokes, hypertension, and diabetes. The thing I like the most is the nurse practitioners. They listen to you. And excellent physical therapy.
Grab that, sit up nice and straight, good posture.
My health is better because I've learned to prepare my meals in a healthier fashion. I no longer eat fried foods. I don't find it appealing. It's just wonderful, and the food is excellent.
You see here that an illness can't be taken care of with just one medication. Someone who's diagnosed with diabetes doesn't just need insulin. They do need the nutritionist, and we have a fitness center so people can lose weight. You can't just write a prescription for someone and solve a problem. It really takes all of the different areas of their life to come together in order to make them healthier.
My name is Lisa Scardelli. I am 43 years old. I have multiple sclerosis. I love the fact that the 11th Street Health Center is in my community. It makes it really accessible for me because I live a 10-minute ride away from here, so I can get here independently. My health in general has improved significantly because of the constancy of care that I get.
96/60. You have a very good blood pressure.
I've lost a lot of weight. I've lost about 27 pounds. I'm more conscious of nutrition, the role of fitness, and how important that is in caring for myself with the multiple sclerosis.
Hi, how are you?
Well, there's 2 parts to our mission. One is to provide care to the underserved, and the second is to be an exemplary community-based practice for the education of students.
So it's going to go underneath, and that
Goes where the artery is.
correct.
For students, an experience at 11th Street I think is very different than in a hospital or in a clinical setting. When they're in other clinical settings, they learn about the illness. They don't learn a lot about the person in their lives and the reality of their lives. Here it's about the people, and I think that comes first.
They learn to care for the individual. You're not an illness. You're an individual.
You go into nursing school thinking you knew what nursing was, and then you go to nursing school and you learn what nursing is, and then you come to a place like this and you learn what nursing could be.
Make sure this is tightened and ready to go. So then once you pump it up, and there's
only going to be more chronically ill, a larger senior population, and so we need trained nurses and nurse practitioners. And it's vital for them to get community training because that's where the healthcare need is.
I hope that there will be a greater use of nurses and certified nurse practitioners in providing primary care to all communities. I'd like to see a health center like 11th Street in every community.